All right, welcome everyone. Welcome to this panel, and so I'll do a brief introduction of what this panel is about. As many of you are aware, one of the most important tools in the tool chest of epidemiologists tackling COVID-19 is the tracking of human movement or human-to-human interaction through their cell phones. We saw widespread adoption of GAEN, which is Google Apple Exposure Notification, or just simply Exposure Notification System. We saw Singapore roll out their Open Trace app very early on. And we also saw some countries skip that approach altogether and use infrastructure-based location of cell phones without user opt-in. Now, we as a community that has done 2 decades of work in wireless location and mobile systems privacy, there are several very, very pertinent questions we need to grapple with as a scientific community about how our work has been deployed and used here, either for the betterment of people by preventing infections, but possibly at the detriment of people by infringing on their privacy. So these are some of the issues we will discuss now with a really fantastic and amazing panel of experts who have looked at these issues from multiple angles and even played a part in their deployment. So I will now introduce our 3 panelists. We have Janet Baseman, who is professor and associate dean at the University of Washington School of Public Health. We have Landon Cox, who's a principal researcher at Microsoft, and Stephen Farrell, who is research fellow at Trinity College, Dublin. So what I'll do is I will now ask each of the panelists in turn to tell us a little bit more about themselves, their accomplishments, any opening statements that they have about this topic, and then we're going to go into a whole bunch of really interesting questions for them. So I'll start with Janet.
Great. Thank you so much, Sharad. I'm so happy to be here. I'll confess first that it's not the type of conference I typically attend or get invited to, so I'm especially excited to hear all of the questions. So as Sharad mentioned, I'm a professor at the University of Washington School of Public Health in Seattle. My home department is epidemiology, so I'm professor of epidemiology. And I have an administrative role in the school as associate dean for public health practice. And what that means is I'm kind of responsible for a lot of the engagement of the school with the public health practice community, including state, local, and national public health organizations that you may have been hearing a lot more about over the last year and a half than you had before. So my research interests have been in public health emergency preparedness and response, including disease surveillance systems. I'm a longtime friend and collaborator of public health at multiple government levels. And ever since I did my thesis when I was getting my master's degree in Houston, I've been really interested in disease outbreaks. I did my kind of foundational work on syphilis outbreaks in the poorest parts of Houston. So my relationship with Bluetooth exposure notification systems has evolved. I've learned a lot over the course of the pandemic. It started in the spring of 2020 when I was asked by the Washington State Secretary of Health to chair a really terribly named committee called the Bluetooth Exposure Notification Advisory Committee for Washington in order to gather a group of stakeholders to recommend whether we should move forward with EN in Washington to state leadership, including our governor. And at that time, I also joined a team of collaborators at the University of Washington and Microsoft Research who were already working on EN planning and development. And after the governor ultimately decided to move forward with exposure notification in Washington, and the decision was made to use the EN Express solution, in the fall, I facilitated a pilot of the WA Notify on the University of Washington campus before it went live across the state on November 30th. And since then, I've been leading a team of folks at the University of Washington, assisting the state with whatever they need by way of technical assistance, and also trying to figure out whether it's made any difference in Washington so far. And to this last piece, which I know we'll touch on a little bit later, my team is taking a multi-pronged approach, is the way I describe it, including trying to assess the system impact of WAN Notify on local public health, trying to look at what exposure notification recipients' responses are to receiving EN messages and the next steps info that they're given from public health. Do they engage in protective behaviors? What are those? We're trying to look at why folks who tested positive for COVID went in for testing to see whether WAN Notify made a difference, and also a focus on impact on vulnerable communities. So I'll stop there.
Thank you, Janet. I'll pass it on to Landon.
Yeah, so I have a few slides that I want to share. See if I can find it. Okay, there we go. So hopefully you can see my screen now.
Yep.
So I, as Janet mentioned, I was also involved with WAN Notify as part of this team at Microsoft and the University of Washington that was trying to figure out what we could contribute to mitigate the pandemic back in the spring of 2020. And so, I had done some work on the underlying technology for digital contact tracing more than a decade ago. And so, in reflecting on the last year and a half, I was thinking, it might be useful to provide some context for the underlying tech. So first, I just have to acknowledge everybody who has worked on this stuff. It's a massive team between the University of Washington and Microsoft and Washington Department of Health and other various organizations. And thinking about what we were able to roll out over the last year and a half is, I think, pretty impressive. So I want to flash back, though, to the late 2000s. And so some of you may have seen these slides. We were publishing a handful of papers here and there in various SIG Mobile conferences, Hot Mobile, MobiSys, thinking about opportunistic communication between devices using Bluetooth. So in reflecting back on the work we had done, I think we got some things right and some things I think we got very wrong. So what I found most interesting about that initial work, though, was the motivating scenario, at least for us, the clarifying scenario for us, was very different than a global pandemic. Let me just say that. So it was basically this, where you've got Alice and Bob, they don't know each other, they're total strangers, but they see each other on the subway platform and they instantly fall in love. But before they can talk to each other, maybe they're just a little shy, Bob gets on the train and disappears. So now what is Alice to do, right? So that was the fundamental problem that we were trying to solve, right? And so we saw this as a form of opportunistic communication where the main idea is you've got two strangers that come into close contact with each other at some point, and they want to communicate, but they don't know anything about one another. And our feeling was this is a generally useful form of communication. You can meet new people, maybe you can retrieve a lost item, which is kind of interesting given all the Find Me and Tile stuff that's been happening. Maybe you can participate in ad hoc discussion. So it's very much a sort of social media kind of view of the tech and how it might be used. And at the time, the way that people did this was through things like misconnections. Now, some of you may be old enough to remember misconnections from Craigslist or your alternative weekly newspaper. This was always one of the most interesting sections of the weekly newspapers where people would basically post, hey, we saw each other at this time. Here are some of the details around our encounter. And the hope was the other party would actually read it too. And then there was a way to facilitate communication, and there were always some details in the encounter that would authenticate one person to another. So if you see the last line of this post, it's, what color sneakers were you wearing? So again, there was this idea that you've got two people who want to try to figure out how to communicate, even though they don't necessarily trust everybody. Okay. So from there, we then said, okay, well, how do we make a digital version of this? How do we do a digital missed connections system? And the solution we came up with ended up looking a lot like the kind of system that enables exposure notifications. So if I then kind of reflect on what we got right, I think that our trust model for thinking about these systems is actually correct. You don't trust the other people participating in the system. You don't trust the server that is facilitating communication between the two people, right? And I think that threat model served us well, and also thinking about exposure notifications. Now, the thing that we got wrong was the applications. Misconnections is not the killer app for this stuff by any means. And it's sort of unfortunate that global pandemic was the most useful application of the tech. But in any case, that's sort of some historical context for the underlying technology. And I guess I'll hand it off now to Stephen.
Hi, so I'm also going to share a couple of slides. 1 second. Yeah, hopefully you're seeing a few slides. So again, I have a couple of slides. So my name is Stephen Farrell. This work was done with Doug Leith, a colleague also from Trinity College. And our approach to this was less to be proponents of something. So about a year and a bit ago, there was a lot of talk about possibly using Bluetooth as part of an exposure notification system, whether that's the Google Apple one or the likes of Trace Together from Singapore. And my background is in security and delay tolerant networking. Doug's was in kind of TCP and Wi-Fi. And we both were a little bit skeptical that the promises made or hoped for results could be achieved as claimed. So we basically set out to test and not to try and propose any solutions or argue against solutions particularly, but just to test and see what happens. So we had a little project called TACT. There's a URL there at the bottom, which has a bunch of papers that we published out of this over the period from, last spring 2020 through to April this year. And our kind of conclusions from all that are essentially that, I think the Google Apple exposure notification and the other ones, they're all well motivated. Everybody's trying to do the right thing. So, I think there's, it's been an interesting collaboration to observe. Although I think there are issues with governance here that need to be noted as well, in that the resulting system is essentially completely controlled by Google and Apple. And the public health authorities in the various countries around the world really don't have control to the extent that the tech companies do. For example, to do with calibration of measurements. Anyway, these systems set out to, as I said last year, have a try and figure out, is somebody within 2 meters for more than 15 minutes? Do you have this proximity or not? And our summary, I have a slide about that, is I don't think that can be reliably done. We'll come back to that in a second. Other than that, I think there's also in the design of the Google Apple exposure notification, and in most of these designs, there are replay attack possibilities, and there definitely exist against the Google Apple one in particular. These are kind of reminiscent of wormhole attacks that you would have seen proposed about all sorts of ad hoc routing schemes going back over the last 20 years. And these attacks are real. I have no evidence that they happen in the wild, but they could have, and they work. So there are replay attacks that have. You might choose to say that deploying the system, even knowing that it has this vulnerability, might be the right thing, but it exists in any case. On Android, which is most of the measurements we did last year, particularly were on Android. There are privacy issues with how Google implemented the service. So essentially, what they did was they implemented the Google part of it, not the Public Health Authority application, but the Google part of this, as part of Google Play services. And essentially, if you want to run an exposure notification app, you must have Google Play services turned on. And when you have Google Play services turned on, it turns out that, as was suspected for many years, I guess, that you're sharing an awful lot of information with Google about, IP addresses, your SIM serial number, your phone number, a whole bunch of stuff that you cannot turn off if you want to run exposure notification applications. And I think that's, again, that touches on the kind of governance aspects and how you should do these things as systems. And then lastly, sorry, and again, I have a slide on this. There turn out to be some systems issues, I think, in how this all integrates, these applications integrate with the contact tracing and health authority systems that I don't think are, at least as far as I can see, they haven't panned out as expected. I haven't a slide of that. Overall, if I had to summarize it, I think it would have been better if these applications had not been proposed as a solution, but as a giant experiment. I think that would have been more honest. And I think some people in academia, some people in industry, some people in health authorities essentially propose these things to their population, saying, unless you all adopt this and deploy it, bad things will happen. You should all do it. And I don't think it was really warranted to make such strong recommendations. It should have been treated as an experiment. For example, it turns out that the design, although quite a reasonable design from a privacy point of view, is a horrible design from a point of view of trying to measure, does it work, or how well does it work? And I think that that's a good example of why rushing to try and deploy this stuff in 1 month between March and April last year was, I think, a mistake. So just a bit more detail on a couple of those points. The distance on reliability, the Google Apple system, it essentially deals in terms of signal strength, or it calls attenuation. And essentially the idea is to measure how close are devices based on signal strength or attenuation. Typically, you see settings that basically divide the measurements into near, middle, or far. And then there's a way of kind of amortizing over those to decide, is it a proximity alert or not? But the near and far thresholds typically are less than 10 decibels apart. And if you look at there, you see the Irish settings that we measured, I think that was about a few months ago. They may have changed because these are configuration settings you can change, but they're less than 10 decibels. So sadly, when measurements we did with different handsets, different orientations, different ways of carrying handsets, whether it's in your pocket, in the front pocket, back pocket, the relative orientations and so on, all of those can kind of add up to about 10 to 20 decibels of what you might think of as noise. So to give an example, just pure calibration, even two handsets of the same make and model might be slightly different, and there may be a need for calibration. There's something like 25,000 different handset types running Android that have been produced over the years. Now, clearly not all of those are important in any given market, but the ones important in different markets differ, and they all need calibrating. And that calibration is done by Google. Apple don't have such a problem because there are fewer models, but that's done by Google under the hood without any influence from the public health authorities. And those updates happen without the public health authorities knowing. So the public health authorities are setting these thresholds, Google are setting the calibration, and that can make measurements go in or out of whack. And I think that's an interesting governance challenge. Secondly, we made a bunch of measurements on buses and trams and trains, and real people sitting on trains. We got cooperation from the local public health authority to make these measurements. And it turns out that, yeah, you're in a metal environment. It's not great for signal predictability. So if you're 3 meters apart in a train, you might appear closer than somebody 1 meter away. And our results that we published show that it looks like under a bunch of assumptions, the measurements are pretty random as to whether you get a true or false positive or true or false negative in trams. Again, all this was done under the assumption that the 2 meter distance was the interesting thing. It turns out, later on, the medics started telling us that aerosol transmission may be more important. So, but we were examining how this system meets the set out criteria. The systemic shortfall was another point. This is nothing to do with Bluetooth, but after somebody tests positive, they're hoped to upload a key to the public health authority server, which is then shared with all the others in a pretty cryptographically sound way. And then when that key is shared, you can trigger proximity alerts as needed. The question is, how many people will upload a key? And it looks like that the proportion of people doing that is way less than you'd expect. So we basically have a measurement job going every hour, measuring the keys that are being published by 33 different services, some of which have merged, like multiple US states are running off the same server and so on. But we're measuring 30 or so servers, downloading the keys every hour and looking at the counts of those versus the counts of cases declared. And so, for example, in Ireland, there's about, it looks like about a quarter of the population have installed the Irish app. If we had declared 1,000 cases on a particular day, you would expect about 200 or 250 uploads, keys. And it turns out you get way less. So we saw, for example, 90% decreases in 90% under counting of keys, under publication of keys in Italy and Poland back in October. And then those were estimates based on counting and figuring out how the whole thing works. But the Irish app itself, inside the app, has statistics on how many keys are uploaded. So between October and April this year, we measured those uploads. And the bottom line is you have you have about only about a quarter of the number of uploads you expect you actually see. And of the last 3 months of the 6, it was only 15% that you see. I think this indicates a bunch of systemic issues. And again, points back to saying that I think this would probably have been better cast as an experiment, designed and tested. You know, I'm so glad that the vaccine developers didn't take the approach that we technologists take and just deploy stuff and hope it works. And in hindsight, and hindsight's great, I think that might have been a better approach here too. Thank you.